Lovely. Thank you for that, Cindy. So following the event, our team will send you an email that includes the presentation that you see today, so the slide deck, along with the contact information for the speakers and staff. I would like to now introduce you to the chair of our Community Leadership Council and the executive director of Sage Seniors Association in Edmonton, Karen McDonald, who will kick us off with a welcome to you, as well as provide a brief overview of Healthy Aging Alberta. Welcome, Karen.
Thanks, Miriam. Good morning, everybody. I hope you're all staying warm and dry from wherever you are. I'm really pleased to be here today on behalf of the Community Leadership Council. Welcome to Healthy Aging Alberta's virtual regional gathering. It is exciting and encouraging to see so many familiar names and faces here today, as well as many new names. Everybody dedicated to making Alberta one of the best places in the world to age and thrive in our own communities. As members of the community-based senior serving sector, we know how important it is for older adults to access services in the right place at the right time, services that meet them where they're at and support and empower seniors in their unique journey. For our society to continue to benefit from the invaluable contribution of older adults, they need to be supported to manage structural barriers that unfortunately exist and become more complex every day. In addition to being the holders of a wealth of knowledge, expertise, wisdom, and culture, seniors are the biggest contributors to philanthropic giving and volunteerism and unpaid caregiving. We all know that volunteers are one of the main enabling pillars of the nonprofit sector, supporting well-being of all demographics in our community. As professionals and volunteers working in this space, you are part of the dedicated and passionate group working hard every day to ensure the rapidly growing number of older adults in our communities are well supported and served. Organizations are doing excellent work in community, and yet limited coordination and the absence of infrastructure prevents us from being able to collaborate as a formal sector with other systems like health and housing, and from having a strong unified voice at tables where decisions are being made about how best to support seniors. Coordinating our efforts is key in meeting the needs of a growing demographic of older Albertans and enabling every senior to age the way they want. The National Institute on Aging's latest survey states that 100% of seniors surveyed from across the country said that they want to age in their own homes and communities. We want this to become a reality through preventative community-based care that allows older adults to thrive while aging in place and improving their health and social outcomes, which will in turn, of course, reduce health system costs, the same goal that our system partners from health, housing, and government share. We need to come together as a coordinated, well-supported sector, ready to fulfill our role in the seniors' continuum of care. For those not familiar with how Healthy Aging Alberta came about and how we got here, here's a quick recap. In 2019, a group of senior serving organizations recognized the challenges stemming from this lack of provincial coordination. Allies at the Ministry of Seniors and Housing also recognized this and supported the community in exploring a solution through a highly collaborative co-creation approach. This concept of sector development was inspired by the success of our colleagues with the Healthy Aging model in British Columbia that has been in development over the last decade by the United Way of British Columbia and community-based senior service organizations across that province. According to the BC Ministry of Health, there has been a decrease in the number of seniors admitted to hospital over the last several years, which they attribute to the high level of integrated community-based care achieved through the initiative's sector development and coordination efforts. As a sidebar, some members of the Community Leadership Council here in Alberta attended the latest United Way Healthy Aging Summit in BC recently. It was inspiring to see how the sector has come together and has developed a strong collaborative and honest relationship with the BC Health Authority. Coming back to Alberta, the What We Heard report was developed early in 2020 in response to the provincial community consultations that some of you may have participated in. This report captured sector challenges and strengths, along with a roadmap for developing a sector in Alberta. Like other projects initiated around that time, the pandemic necessitated quick shifts and the focus became a pandemic response. Healthy Aging Core Alberta, a free member-based digital knowledge mobilization, learning, and collaboration hub dedicated to Alberta's community-based senior services sector and its allies, was quickly developed and launched to help organizations who are now serving the most at-risk population during the pandemic. After this launch, the interim Community Leadership Council and government allies refocused on the sector development roadmap. The community came together in 2021 during virtual regional community activation sessions, which were attended by 350 sector members, branding this initiative Healthy Aging Alberta. Since then, we have been making our unified voice heard through our stakeholder and government relations work and have been successful in advocating for investment to implement a regional approach to sector development, building capacity across the sector through the Constellation of Networks model, and implementing aging and community supports and social prescribing programming that will act as a catalyst for the development of coordinated, sustainable provincial models and networks. The recent announcement from the Government of Alberta of committing more than $6.3 million to improving the lives of seniors in Alberta includes $3.2 million to Healthy Aging Alberta, which will focus on community and home supports to enhance the mental health of seniors. We're in the process of coordinating how the funding will flow into community-based organizations across Alberta. Information will be shared soon about how organizations can express interest for this funding. We are grateful that this work has been funded by the Ministry of Seniors and Housing and the Ministry of Community and Social Services. Next slide. In a nutshell, Healthy Aging Alberta is by community for community. A provincial initiative that brings together a rich network of community-based organizations from across the province that are united together. I want to emphasize that you can engage in this movement where it works for you. There's a place for everybody as we work to collectively advocate, share knowledge, and create communities for healthy aging. Let's quickly touch on the principles that guide Healthy Aging Alberta, which the community-based senior services sector community has identified. We are, of course, collaborative. We are community-driven. Community organizations are experts in their work, and communities in this work is driven and led by the collective needs and guidance of the sector. We are diverse and inclusive. The diversity of seniors and the sector must be represented with inclusive practices to ensure equitable access. We are flexible and dynamic. The sector members can connect and participate at different levels based on their capacity, expertise, and interests. We are action-oriented, focusing on incremental wins while working on the big picture. And mostly, we are senior-centric. Our work is focused on supporting organizations to build their capacity, access information and resources, and work better together and with other systems. However, seniors are at the heart of this work, and the well-being of older adults in this province is our North Star. We recognize the importance of having older adults at the table and ensuring that they can speak to their experiences and contribute to the sector authentically and fully. Meaningful and equitable engagement needs to be done well, and we are exploring ways of creating mechanisms that support the participation of seniors in a way that works for them and reflects the diversity of older adults in Alberta from different regions, backgrounds, and walks of life. As I share our strategic objectives revolving around the seniors at the center, let's highlight actions currently underway as part of the sector development roadmap. The first objective is to establish and coordinate the community-based senior services sector, which articulates the impact of a formal sector with a unified voice and advocates for the values and interests of community-based organizations to relevant stakeholders. Establishing a community leadership council to provide sector leadership follows this mandate, guiding the sector's work within an interdependent system. As the third sector representing community supports, Healthy Aging Alberta works alongside other sectors and forms a strong base and foundation within the broader seniors care system. Working system to system, we can have a fulsome discussion around non-medical supports. Prior to the formation of Healthy Aging Alberta, there were very few mechanisms to facilitate the conversation broadly about things like primary and secondary prevention alongside more complex models of intervention, which encompass all aspects of community-based sector within a broad spectrum of care. The advantages that we have in Alberta involve a single healthcare authority and the inclusion of a unique FCSS infrastructure. The challenges in Alberta is that the work required in building towards an integrated system, especially as other jurisdictions have more integrated government, health, and senior services. Our unique landscape shapes how we engage the work provincially and regionally. In establishing and coordinating the sector, we shared that Core Alberta is the platform for a provincially coordinated collaborative network. With over 1,300 core members and 18 core groups, meaningful connections have been made and collaboration on various issues has taken place. We hope that you're already part of this. Alongside CORE, provincial and regional sector weaving development work is being carried out through the Constellation of Networks model that many of you may be aware of. We're in the process of activating 5 regional community developers, or RCDs, in each of the Alberta Health Services health zones to support community-based senior services organizations to come together as a regional network for collaborative opportunities and joint advocacy. In attendance today are our 3 current RCDs. Please say hi to Barb for the Edmonton region, Marla for the Calgary region, and Lauren for Southern Alberta. Everybody's waving. We are currently recruiting for Northern and Central Alberta. If you know of anyone in these regions who would be a good fit for this work, please contact us. We are happy to answer any questions anyone might have. The RCDs are building on the initial live systems map that was created last year. The purpose of this map is to visualize the players in the sector and their relationships to one another, which we'll cover in more detail this afternoon. Next, let's talk about the approach that underscores our work. Community development is vital, and we carry it out by increasing the cohesion and capacity of the sector and by identifying opportunities for collaboration with system partners through formalized connections like in systems mapping. Having an established infrastructure as a sector allows Healthy Aging Alberta to have the resources to act in a systemic way and prioritize initiatives that did not previously exist. Moving into the future, we can activate work in a systemic way, enhance programmatic initiatives, and develop longer-term strategies. Additionally, we are informing and influencing broader national, provincial, and local efforts for coordination between community organizations and systems to facilitate community-based responses and resources, keeping the communication channels open between all players. By increasing provincial discussions on sector-relevant issues and policies, we can improve our advocacy for solutions such as home supports and social prescribing, which we'll look at in more detail. Social prescribing is a person-centered, holistic, and structured approach to bridging health and social models of care through the development of formal referral pathways from a healthcare provider into home supports or community-based services that enable older adults to continue to age in community. These non-medical supports can cover a broad range of services. Developing trust-based collaborative relationships with seniors and their medical and social care team is critical to support seniors to continue to age well in community. Several international and national examples of successful social prescribing models report enhanced health and social outcomes for seniors and reduced hospitalizations and early admissions into facility-based care. Alberta has the appropriate infrastructure to benefit from social prescribing models, including a single health authority and a primary care network model that serves over 85% of Albertans. The required infrastructure also exists in the social sector by developing a community-based senior sector through Healthy Aging Alberta. Alberta has a high level of interest and readiness for social prescribing, both within health and community systems. There are currently multiple projects at various levels of maturity that can be leveraged towards developing a provincial social prescribing network to ensure a consistent approach. The provincial government has made an initial short-term provincial investment in community in the home support space that will be facilitated through Healthy Aging Alberta, as well as more targeted investment in the social prescribing space. However, to support a more sustainable funding shift from health into community care, Alberta-based data is required and critical to the timely development of a systemic approach to non-medical community-based supports. Focusing on these issues is a large part of the work that we do under our last strategic objective, which is focused on advocating for appropriate investment in the sector for the implementation of this type of transformational model. Our last strategic objective is to advocate for appropriate and coordinated investment in the CBSS sector, which entails securing resources for priority areas of action through establishing a formal fund development mechanism to explore sustainable resourcing options provincially, regionally, and locally. I mentioned before that funding remains an issue for Alberta's CBSS sector. For instance, at the beginning of the pandemic, our neighbors in BC did not have to compete for funding. Imagine that, as they had an organized approach to dispensing funding among its agencies and services. This was not the case in Alberta, where we did not and still do not have a mechanism to arrange for that. As a result, we saw organizations compete with one another for funding with minimal coordination and shared evaluation. A Made in Alberta solution that could rectify this problem is to develop a funders table to flow resources to CBSS sector in a more cohesive, efficient way. Our vision is to see that infrastructure strengthened to support the work of existing organizations. In addressing priority issues as a sector, we also recognize the value in having a common language and framework from which to speak, which we hope the Healthy Aging Framework you'll hear about later today will facilitate. Going back to our community development approach, let's discuss what the community shared with us in a survey and community conversation that we had late last year. Healthy Aging Alberta asked service providers to help us capture the current state of the sector by describing their current capacity, service delivery, and resource challenges and opportunities. You can see the themes listed, which reveal the challenges we have faced, but also that we have all continued to move forward and find innovative ways of resourcing our work and connecting with seniors. This snapshot in time also reinforces the issues and gaps that you shared with us. The top 10 issues that emerged reveal that what you have been amplified and further exacerbated by the pandemic. You can see that the first 5 items listed on the next slide describe the decline of older adults' physical and mental and social health, which tangibly impacts the complexities that older adults face in the next 5 items listed. We also asked respondents what services or organizations offered to seniors, which we share with you to indicate the breadth of programming represented on our call today. The full results are available on Core Alberta, and we'll share that link in your post-event email if you're interested in learning more. Essentially, prior to the existence of Healthy Aging Alberta, we could not get a pulse on the sector. By relaying what concerns should be prioritized, we can now systemically address the struggles our social system is facing. Continually capturing the voice of the community is essential as we can be a vehicle between sectors, other systems, and each other. As such, Healthy Aging Alberta belongs to you. We want to know what your priorities should be going forward. We would like you to think about these questions over the course of the day today and share your thoughts with us. Later this afternoon, we'll loop back to these questions and we'll have a conversation as a larger group where we want to hear from you. I now want to introduce you to Anne Smith, who will take us through the Healthy Aging Framework. Anne, over to you.
I'm unmuting. Good morning, everybody. My name is Anne Smith, and it's my pleasure to speak to you about the Healthy Aging Framework, but I'll just introduce myself first. As I said, my name is Anne, and I have been a community-based consultant for over the last 30 years. So literally hundreds of conversations around strategic and operational planning. And over a decade ago, I responded to an RFP from the Edmonton Coordinating Council. Edmonton is my home community. And through that work, entered into the world of community-based serving organizations and healthy aging. And in 2017, 2018, I had the opportunity to do the focus groups that were part of the research done for the Healthy Aging Framework, which was undertaken by the Alberta Association for Senior Centres. And now it's my pleasure to work with Healthy Aging Alberta to try and take that framework and turn it into practical tools for organizations. So what I'm going to do in the next half an hour or so is give a presentation on the Healthy Aging Framework, looking at what the framework is, its content, how we can use the framework to support planning and evaluation work, and a scenario. And after that, we can take questions. We'll then have a break, a well-deserved break, and then we'll work in small groups so that you can begin to the best of our ability virtually to see what the framework is like and how you can apply it. So that's what we're going to do this morning. So what is the Healthy Aging Framework? The framework is a made in Alberta tool based on the World Health Organization's social determinants of health, and it focuses on healthy aging in Alberta. The framework's purpose, what it can be used for, is to articulate, organize, and communicate the work of individual organizations as well as collaborative initiatives. So in essence, to tell and develop the story of community-based senior serving organizations, the programs and services they provide, and the immediate and longer-term benefits that are being achieved for older adults in our community. And although the research and the report that was published in 2018 was developed for senior centers, this model or approach, this framework, it can be used for all community-based senior serving organizations. So a framework, in essence, any framework, and I know we are familiar with different types of frameworks, is a way of organizing information so that systems, ideas, and actions can be communicated and understood. It's providing us, community-based senior serving organizations, with a common point of reference, a way to clearly articulate our work and to develop a common language and to understand and connect with one another. And in my experience of facilitating groups over the last 30 years, I must say that one of the things that I see that causes us the most frustration and often the most time is that we have shared intention, but without common language, we often get frustrated, or it takes us time to work through that we are actually all talking about the same thing. So this framework allows us to have common language and begin to compare apples to apples rather than apples to oranges. So think of it as a shared language or structure that can be used by a wide variety of people so that they can all understand each other and see how they fit together. So we can not let language get in the way of our work, but focus on our intention. And having a shared language and way of organizing our work helps us to build common understanding and vision. This helps us to work together and create efficiencies across the sector. And it also helps us to communicate the value and impact of our work to other systems, such as housing and health. And I have seen this approach work well within the public library sector, where common language has allowed them to easily understand the service areas where they are working together and to look at collaboration initiatives. So the idea is basically that as senior serving organizations are all using the same framework to help them, and I emphasize it's a tool, a support, to help them think about and communicate their work, then we can identify service gaps, we can minimize unnecessary duplication, we can identify opportunities for collaboration and coordination, and we can make it easier for seniors to access the services they need through the work that we're undertaking related to navigation and system support. So it's a tool that we can use for strategic planning, priority setting, and evaluation within organizations, but also for coordination of the work across the sector. So now I'm going to look at the components of the framework, and we're calling these building blocks. And I must emphasize that although I'm presenting this in a linear way, these blocks are interchangeable. You can use them and enter into this framework at any one of these component parts or these building blocks. So the first building block are the determinants of healthy aging, which, again, very sophisticated language I'm going to use. They're like big buckets or categories used to organize all those things that impact the healthy aging process. So they're categories that summarize each aspect of healthy aging. And health in this context is understood as broadly as possible and includes the social determinants of health. For example, income and social connectedness. And these determinants of healthy aging are used to identify what older adults need to age in their home communities. The next building block are service areas, which are bundles of programs and services that organizations provide. A service area is a way that community-based senior serving organizations serve older adults. The programs and activities and services the organization provides to meet the needs of older adults established by the determinants of healthy aging. Activities are the specific programs and services that organizations are providing to benefit older adults. Outcomes, and we've called them intended outcomes in the framework, are things that we think about, the things that we think about or the things we know will change for individuals as a result of the work that we're doing. Outcomes are basically the things we think will happen for the older adult if we invest in a particular service area and undertake particular activities. The fifth building block are impacts. And impacts are those longer term things or factors that we believe will change more generally as a result of the work that we're doing. Impacts are the benefits for older adults an organization expects to see as a result of its program and service activity. So if we move to the next slide, I must emphasize, though, that when we did the focus groups, and I think the work of Healthy Aging Alberta continues to bear this out, that the context piece for using the framework is critical. We can't tell people how to use these building blocks. All of us know our communities. We know the populations that we're serving, and the framework is designed to support you within that context that you understand so well. It's designed to give you common language and to support your planning and evaluative processes. So I want to really emphasize, I may say it too many times today, that the Healthy Aging Framework is not prescriptive. The ability of community-based organizations and neighborhood-level organizations to effectively meet the needs of their service demographics and geographic area does require that organizational autonomy. So this is a tool designed to support your work, and the framework is simply a way of organizing the work of diverse organizations across varied contexts, serving deeply different populations. So if we look, this is a schematic. Again, I will emphasize it shows it as a linear process, but we do not need to use it in this way. So you'll see the logic of the framework goes from the determinant of healthy aging to the service area, to the activity, to the outcome, to the impact. But perhaps as I'm speaking, you say, well, I'm not really getting the framework at all, but I know what I do. I'm organization A. I know the activity that I am undertaking. So I can enter in knowing that activity and then use the framework to say, given the activity that I'm undertaking, what might be some of the intended outcomes that I can achieve, and how do I connect that to broader based impact? But I can go the other way in the framework, is I could say, well, I have a particular activity. What might bundle of service or what service area might I be part of? That might help me make connections with other service providers. And I can also then link through the framework the determinant of healthy aging that I'm contributing to. I can then define in very broad-based terms how I am supporting the healthy aging of older adults in my community. So this slide is just designed to demonstrate how we could use the framework, and we could enter into the framework in any way that makes sense to us and the work that we're doing. So now I'll just quickly overview the content of the framework itself. So the framework has 6 determinants of healthy aging. And as you can see on the screen, these are physical environment, physical and mental health, social support, personal well-being, safety and security, and social environment and engagement. And there are 6 interrelated categories that determine our ability to remain as safe, healthy, and active as possible as we age. And as the work of the senior sector organization, all of the work, of the senior serving organizations do fit easily within one of these categories. They are very broad-based categories of activity. So for example, a yoga class is part of physical and mental health, and so would be foot care. A tax clinic belongs to safety and security. A grocery or meal program fits within personal well-being. So they're quite broad, these categories, but they do provide us a general structure for the framework and the areas that we would want to act in to support healthy aging. So if we go to the next slide, we will see that here are our service areas. They are organized by those determinants of healthy aging. There are 22 of them, And I don't want anyone to panic when you think, my goodness, this framework is becoming big. How am I going to manage it? How am I going to keep it as a frame of reference? We are developing tools, and we'll explore those later today, to help you focus in very quickly on the part of the framework that has most relevance to you. You use the content for that. You use that content, and you don't need to worry about the other pieces. So for example, if we look at physical environment, we'll see there's 3 service areas or bundles of service, and those are transportation, housing, and home supports. So if we go back to some of the examples I just shared, a yoga class is part of physical and mental health in the physical fitness service area. A foot care clinic is part of the same determinant, but belongs to physical health and the wellness service area. A tax clinic belongs to financial security, the financial security service area of safety and security, so that each service area can be tied to the determinant that is relevant to it. And in this presentation, we have not outlined all the outcomes and all the examples of service, but for every service area, so for example, if I went back to physical environment and transportation, for that service area, there are lists of intended outcome and there are examples of activity, so that you can begin to dig into that work as you begin to say, I know I'm involved in transportation, now I want to look at my program option in terms of activity, and I want to begin to discuss intended outcome. So if we move to the next slide, we'll see here there are 12 impacts. So these are the broad-based results we would anticipate that we will see for older adults as we do and measure the work that we are undertaking. And you'll see, for example, the first one on the slide, increased capacity to live independently by enhancing physical wellness, that they are all structured in a way that is telling us the result we are seeing for the older adult. So if we looked at that, if we look now at organization A, we'll move to this next slide, we'll see that if we know that we are undertaking a tax clinic, if I enter in terms of that activity, I know by looking at that tax clinic that I am in the financial service area. That bundle of service is all about financial security, and that the determinant of healthy aging that I am contributing to is safety and security. But I now can look at outcome, and as I said, their intended outcome. And when you get a chance to look at the framework, you'll see there's far more options for outcomes than any one program might strive to achieve, but you begin to select the one that has most relevance to you. So for this tax clinic, we would say, if we do that well, and what is the outcome we want to assess, it would be increased capacity to maintain or improve financial safety and security. So that is an example of how the framework works. So as I mentioned, that one of the key building blocks, and we've seen there's 12 of them, is impact. And so from knowing the determinant of healthy aging, the service area I'm acting in, my particular activity and outcome, I can then link my work to that broader based impact or result that I am contributing to through my work. And in this case, that would be the increased capacity to maintain personal safety, security, and the integrity of personal decisions as one ages and personal circumstances change. But to show the connection and how we might begin to work together, if I were another community-based senior serving organizations, but my program is employer brokering, I can see that my service area is different than the person undertaking the tax clinic. I'm involved in vocational training and support. But the determinant of healthy aging I'm responding to and working towards is safety and security. So I know I have something in common with the individual who's involved in the tax clinic. Again, my outcome is distinct to my service, particular service and organization. And so in this case, the outcome I'm focused on is increased ability to remain in the workforce. But again, I can see through using the framework that the impact I'm working to achieve through my employment brokering activity actually is the same impact as the individual's organization that's providing the tax clinic, that increased capacity to maintain safety and security. So it's important to note that our service areas, our activities, our outcomes will be very dynamic, but we can, using the framework, tie ourselves to what is the issue around the healthy aging of the older adult, the determinant of healthy aging we are striving to address, and what is that overall larger picture impact we are working towards achieving. So we can use this framework to structure our own activity, but we can also use this framework to make connections with others and to develop collaborative activity. So this slide is just a demonstration to try and show how the framework connects us, but enables us to have that organizational autonomy. So we'll see that knowing the determinant of healthy aging we're working to contribute to and the impact we're trying to achieve creates connection across organizations. But as I have mentioned, the service area, the activity, and outcome are designed by us and implemented by us in order to respond to the context that we're seeing in our community for the population that we are serving. So now I'm going to quickly move, I know it's a lot of content in a very short period of time, to how we might use the healthy aging framework to support strategic planning. So as I've described the building blocks, I hope that people can see that the building blocks for the framework move us from broad-based intention, the 6 determinants of healthy aging, to the strategic focus of our work, those service areas for each determinant, to the outcomes we're trying to achieve, to the activities that we are putting into place to realize those activities and reach our intended impacts. So we are moving from a why to a what. And a strategic planning framework, I know there's many processes and we can make that strategic planning process too complicated. I don't think it needs to be. Again, the logic of a strategic planning framework takes us from what is that strategic direction and intention we're trying to achieve? Where are those strategic areas for activities we want to undertake? What are the results we hope to see? And what is the action that we will undertake in order to reach those outcomes? So as we've said, this framework then allows us to begin to answer strategic questions. That's good. A little too quick for me, but we're good. We'll keep moving through it. So I think I just wanted to emphasize so that this is how the healthy aging framework could be used in your strategic planning process to answer the questions that you have, as opposed to give you prescriptive answers. And we move to the next chart. That's super. So really, any strategic planning process is really all about answering and what are the questions we want to answer and how will we find those answers. So in the work we're doing to apply the healthy aging framework, we have looked, and I know this is very small, it might be hard for you to read, but what we're doing, we have an intention to develop a very detailed handbook, which would give you applications for how to use the healthy aging framework to understand dynamic and unique community needs. And you can see there's some questions here posed that would be things that we would want to ask ourselves if that was our area of interest, our vision for healthy aging and organizational focus, our identification of strategic direction and goal setting, our intended outcomes, our activities, and evaluation in terms of impact. So this chart just demonstrates that if strategic planning at its heart is really about answering the questions you want to answer for your program, your organization, or your collaboration, that this framework is designed to support you to answer those questions. And we do, and I'll just give you a visual picture of it. There is a primer, I hope everyone can see it, that is going to be sent out to everyone. This has the content of the presentation and an example of how you could use the framework to develop a logic model if that's your interest. So it's one way to use this tool, but I believe the Healthy Aging Framework has as many applications as our imagination. And my colleagues would say that I should stop imagining. I think at times, I've made it more complicated than it needs to be. So what I'd like to do now is to take you through an actual scenario so we could see how we might use the strategic questions and you then use the framework to answer them. I'll go through the scenario and then we'll work through that process. But I just wanted to say that some of the visuals that you will see are based on a card deck that we have created so that you can use the framework more easily. So I'll just demonstrate there. Cards look like this, and you'll see visuals that show the cards. When we break after when we come back to small groups after our coffee, you will see a virtual version of these cards. So there's two tools that are in their pilot testing stage. One is physical cards, which your regional community developer could bring out to you, and you could work with them physically to sort through the building blocks of the framework. And the other is the virtual tool that we'll look at after coffee. So I'll go through this scenario of Emma and the Wild Rose Senior Center, and then I'll take questions. So just briefly, in our scenario, we are listening in on the conversation of Emma, who is the Executive Director of the Alberta Wild Rose Senior Center. The center is located in a community about 100 kilometers from a larger urban center, and the population of the community is about 20,000, and approximately a quarter of the population is 55 years of age and older. So that's Emma's context. And the center has served older adults for over 20 years and provides a range of activities for older adults. And these activities include clubs and groups, opportunities for connections such as field trips, special events, and a referral and information program that connects older adults to needed services and supports. So if we move to the next slide. So Emma is the executive, same slide, I think. So Emma wants to tell the story of the center more effectively, its impact, how it contributes to healthy aging, the service focus of the center, and the outcomes it achieves. And she believes that if she creates a strong strategic framework for the center, she'll be better able to secure funding, help her board be stronger advocates, and improve her ability to identify common ground with other community-based organizations. So Emma, of course, she believes that the Healthy Aging Framework can support and streamline her strategic planning efforts, and she's going to use it in 4 ways to answer 4 critical questions for her organization: to identify the center's healthy aging focus and impact of its programs, to identify the service area focus for the center, to identify the intended outcomes for the center's program, and to review the center's activities moving forward. So if we now, I think we'll move now to the mural. You'll see this is a visual that we're going to use in our small groups. And we'll take Emma, we'll use this exercise for two purposes: to show you how the framework works, but also to give you some familiarity with the mural that will be part of the work that you do after coffee. So step one for Emma was to identify the healthy aging focus and impact of her programs. Now, I myself cannot see all 12 cards, so perhaps we may have to make it smaller. But these, as I said, are the physical cards that have been developed. There are 12, these are our 12 impact statements in the framework. And so the first question that Emma and her team are asking themselves are, what is the overall intention of the center? What's the impact we hope to see for older adults as a result of these programs and services? And if we go back and look at all those 12 impacts, the first inclination of Emma and her team was to say, oh, well, we do all 12. We do all 12 of these. But Emma knows that given the capacity of the center, and to really achieve action at a standard of excellence, priorities must be set. So she really pushes her team to say, but where in the next 2 to 3 years do we want impact for our center? And as a result of that discussion, Emma and her team picked 2. And if you'll note the cards, and you'll see this on the virtual tool and the physical tool, they're color coded. So when Emma and her team pick those 2 areas, increased sense of meaning, purpose, and connection to the larger world, she'll find a navy blue deck of cards. And we'll see this on our virtual tool. We'll see a navy blue section of cards, and reduced risk of isolation and loneliness. Again, there will be a bundle of cards, whether you're looking at the tool physically or you're looking at the tool virtually. So now Emma and her team know what their impact is. That's a very important piece of information, because the framework is designed so that one can look at impact and say, well, where do these impacts lie? What is the connection to the determinants of healthy aging? So using the framework, Emma and her team can connect those impacts and see that the social environment engagement determinant of healthy aging and the personal well-being determinant of healthy aging relate directly to the impacts they're achieving. So by that first discussion of impact, they now know what are those large areas of focus of support for a healthy aging they're trying to support, and what are the big picture impacts they're striving to achieve as they continue to develop their strategic plan. So that would be the end of that first question we wanted to answer, is what's the overall intention of our center? So then Emma and her team moved to step 2. And step 2 is to see what are the service areas that they really want to focus on. And the way that this tool, whether it's virtual or the physical cards, is organized is that every card has on the bottom of it a service area written and an intended outcome. So the first way that this tool is used is to say, well, what are these service bundles or service areas that connect to the increased sense of meaning, purpose, and connection to the larger world? And what are the service bundles that relate to reduced risk of isolation and loneliness? And if we scroll to the top, you'll see that there are 4 service areas connected to the impact of increased sense of meaning, purpose, and connection to the larger world. And there are 2 service areas connected to reduced risk of isolation and loneliness, participation and engagement, and social engagement. And you'll see that there is a common service area identified in each of these impact areas, but the intended outcomes are different. So because we are not sure how people will use the framework and interact with the framework, you will see that there is some duplication of outcomes as you work through the cards, depending upon the service areas that you pick. So we know now that for the impacts chosen by Emma and her team, that there are 6 potential service areas that they might focus on in order to achieve the impacts they've selected. And the question they are asking, the strategic question is, what service areas will we pursue to bring about the impact we wish to have? Now, again, Emma had to push her team a little because when they looked at the 6 areas, they said, well, we'll act in all areas. That's important to us. But again, Emma said, we really need to use this as a strategic framework. Where are our priorities? Where do we want to head in the time frame for this strategic plan? And in this example, they pick 2 service areas, and those are social engagement and participation and engagement. So by definition now, all the other service responses, so for example, outdoor activity, emotional well-being, they can be taken away. We don't need to worry about that content. And I really stress, I think, using the framework where we begin to use impact to help us focus in helps us when we get to the outcomes piece, because as you'll see just visually with the mural, there are many intended outcomes. The framework's not designed to suggest to you at all that you must be pursuing all these outcomes. They are given to you to stimulate thought and to help you hone in on what are the outcomes you want to achieve. So we are about to move to step 3. So now Emma and her team, they know the social determinant of healthy aging they're contributing to. They know the impacts they're striving to achieve. They know their priority service areas, and they're now grappling with the question, what are our intended outcomes? What are the outcomes that will tell us that we are achieving, we're moving towards our impact, and we know where we're going, where we're headed. So you'll see the critical question for them is, what outcomes do we expect to see as a result of effective action in our priority service areas? And I know you can't see all the text, so the cards are too small. And when we move into the small group work, we'll be in smaller group and we'll be able to expand the screen. But the intention here is just to say, of those possibilities, over 20, Emma and her team, they decided on 6. So when they answered the question, what do we expect to see as a result of effective action in our priority service areas, they identified increased opportunities to have fun and enjoy life, increased access to programs and services that foster social engagement, increased social connectedness, and reduced isolation. And in that participation and engagement area, they looked at some systems issues. And you'll see when you get an opportunity to look at the framework in more detail, that there are activities that are direct result for the older adult, but there are also systems or organizational outcomes or benefits. So you'll see for participation and engagement, the focus became more systems oriented, and it was increased access to programs and services that foster participation and engagement for Indigenous, marginalized, racialized, and or low resource seniors, and increased ability to navigate or engage with government and or community-based programs, systems, and services. So now when we begin to think about what Emma and her team know and what strategic questions they have answered through using the framework, they know the determinants of healthy aging that are most relevant to them. They have an understanding of the longer term impacts they're trying to achieve. They can look at those priority service areas, the strategic intention of their program, and they can identify the intended outcomes they're striving to achieve. So if we move to the 4th step, the 4th step is then to say, well, what do we think about our activity? Are we undertaking action that is actually contributing to the outcomes and impacts we've identified? In the framework, you will see examples. And so in this case, Emma and her team, they looked at the examples and they said, we're in pretty good shape here. We think that those activities typically undertaken to reach these outcomes, we in fact are doing. And you'll see those are clubs and groups, the field trips, special events, the operation of a cafe, spaces for informal gathering, and her referral and information center or activity. So as a result, excuse me, as a result of using the healthy aging framework, you will see that Emma, they can tie their work directly to the determinants of healthy aging. They can articulate the impact of the center's work and the priority service areas the center is pursuing. They can identify the outcomes that are going to be used by this center, and they can begin to say, how are we going to measure those outcomes? What data do we need to collect? And they can begin to tell their story more effectively. So that's the result of using the framework. And then when we think of what might she, beyond having a strategic framework, how might Emma use all this information to the benefit of her organization? She can use the information you see on your screen to develop a funding proposal with a focus on isolated and at-risk seniors that's been let in her community. She can increase her board's awareness of the impact the center is trying to achieve and the contribution to healthy aging the center is making. So this will support advocacy work. They can begin to focus the center's collaborative partnership work on relationships and initiatives where common outcomes and impacts are shared. And they can begin really to dig into whether that data collection activity within their center is actually telling the story that they want to tell related to the outcomes. So a great deal of information in a short period of time. I think our timer is telling us we have a few more minutes. If there's a question anyone wants to ask. I know it's a lot to process very quickly.
That was great, Anne. You have a couple of comments in the chat box, not so much a question at this point. Sharon wanted to say how she could see the service areas are all interconnected. And Robin wanted to comment the pink triangle in the graphic and the focus on activities is the large base. Often we plan and not implement and just try something. So that really resonated. And
yes, so those examples of activity are not designed to be prescriptive, but let's say you're beginning to work in an area you've never been in before, then it's to stimulate your thought to say, these are the things that organizations typically do. And that's all based on the 2008 research that was quite extensive and did survey senior centers. So the information comes from service providers in Alberta. A question, or I've exhausted you all? I'm hoping my excitement for this tool is coming through the computer, because I do think a common language and a frame of reference that helps answer those strategic questions will really make our strategic planning efforts more effective and will really begin to focus in on what we're trying to do. As I said, I've seen this work in libraries, and I must say that the library framework just has service areas. It's much simpler, but its focus really is on saying, where will our priorities be in a set period of time to meet the needs we see in our community? So the idea isn't that you would use this framework once and then walk away. It would always be an interactive tool based on the context that you see. But as I've said before in previous presentations, if we walked into libraries that have used this process and say, one of our priorities is create young readers, there is no real discussion needed about, well, what's the age group you're focused on? What are the outcomes you're trying to achieve? What are the activities we typically undertake? They have that common ground to begin to say, well, should we push our age range 1 or 2 more years, given what we're seeing happening with literacy? They can begin, what about digital literacy? They can begin to have conversation about the issue at hand for the benefit of young readers, rather than trying to figure out what is a young reader, what programs are we trying to offer, what are the outcomes we're undertaking. So that's just an example of how I've seen a similar approach used, but this is much more fulsome in the sense that it has impacts and outcomes. So the red, I can see the, Yvonne, can I take the question? I'll ask our timer. One question, Yvonne, is that okay, Marla? I'll give
Quick
you,
question, you bet.
okay. I'll answer Yvonne's question and then we'll take a well-deserved break.
Okay, everyone, sorry, it's not a question, but a affirming comment. Of course, many of us are thinking of Indigenous and ethnocultural seniors, often that they have a bit more even complex life realities, right? And so I was just thinking this framework allow for a few more things, is more than help them navigate the existing system, is actually identify not only barriers, but gaps in services, right? And so some of the, I'm sorry, I might be still not eloquent with the language, but wherever there's the outcomes or impact, it could lead to a collective sense of systemic efficacy, so that wherever there are barriers, but then also gaps, you know, what could we do with the current system, or what can we catalyze in the community? So I'm just affirming the framework allow for that, and maybe we could add a few comments. That's all, Anne. Thank you.
No, that's great. And I do think we're trying to say the framework is, in a perfect world, together, we would touch upon all of the areas within the framework, and we would begin to ask ourselves, what are the activities that we need for these outcomes and these impacts for all older adults? So any input you have on how to really enhance or improve that understanding would be very, very helpful. So I believe now it is time for our break, but again, any feedback you have on this process would be great. We're going to take a 10-minute break, which I believe would bring us back at 11:16. We'll come back as a group as a whole so we can explain the process of small groups, and then you'll get an opportunity to begin to look at the framework in a bit more detail and discuss your own ideas about how you might apply it. So we'll come back at 11:16. And so what we're going to do now, and I think if we just we are going to move into small groups, into breakout rooms. You will see that there'll be a mural, and the mural will have the whole framework, all the cards. So I don't know if I showed physically how big potentially the framework is, but you will have a virtual version of all these cards. What we're going to do is have your Healthy Aging Alberta team member is going to take you through a program example, and then we're going to ask you to think of examples you'd like to share, and we can then use the cards to see the logic of the framework and how it might answer some of the strategic questions you have. I should have mentioned that although a program, by definition, a program example will be simpler, the logic holds. So whether you're trying to look at a plan for a program or you're trying to develop a strategic framework, the cards are used in the same way. So we're going to take approximately 30 minutes to have an opportunity to plug and play and see how the cards work and can be how we can use them interactively. And then there'll be a final opportunity for any questions people might have about the framework before lunch. So I believe you will be assigned to a breakout room.
All the rooms are now open. You will get a prompt. Please click join to get vortexed into your room.
Time went.
This meeting is being recorded.
It was a great conversation, but we just, I think, under the wire finished the conversation. So hopefully that gave you a sense of how you could use the framework and how it could be manipulated. As I said, there are the virtual tool that's been developed. There are also the physical cards. And I just wanted to look at this framework one more time to wrap up our conversation, in the sense that we are using the framework to answer those strategic and evaluative questions that are most important to you. So the framework is really designed as a tool that will support you, given your context and given those you serve, to begin to ask those fundamental questions that are a priority to you. And then I think we have one more slide just to connect you to resources. So in the beginning, I think it was Karen McDonald identified that there are 3 regional community developers that have been hired to support you, and that that is a resource for you that you can call upon to support you. They can bring out these cards, they can help you understand how to use the framework, and that there is a primer that's going to be sent to you electronically, which again gives the overview of the content. And for those of you who want to really get down into that operational piece, takes you through an exercise to develop a logic model. So in the time that remains to us, and I will check 7 minutes, any questions, observations about the experience of trying to use the cards?
You're getting lots of compliments in the chat box, Anne, about how fantastic it was. I don't even think our group got to the end. I thought it was going to be too much time and we could have used more in the end. So it was that
really would be the experience of my group. We had to rush to the finish line.
But everybody is saying such a great tool, and thank you, that it was fantastic, that they love it, that this is awesome. Thank you, Anne. So yes.
Any other comments from, I don't know if the other regional coordinators, if there's something you want to say about your role or how the framework is used? But that resource is here so that this is the starting of a conversation. And if you want to make that connection to really dig into how to apply it to your own strategic questions, Healthy Aging Alberta has a resource to support you. I think that's the important piece to remember, that there's a way to keep this conversation going.
Shauna was commenting, knowing that the virtual cards will be sent to you. For now, it's the primer that's being sent, Shauna, but we can set up a regional community developer to come to you if there's one in your region, or we can meet with you virtually now that the cards have been set up online, because as Karen has said in the next comment, big thanks to the team to set this up virtually. I think that goes to Cindy and Miriam, between Cindy creating all the things and Miriam helping her load up the 198 and Cindy designing those cards. So yeah, Shauna, we can actually, if you want to reach out, we can make arrangements with you for someone to connect with you and work through the cards.
Hi Anne, it's Janice. Nice to see you.
Hey Janice, nice to see you.
Yeah, in our group, I just had a question. I was just wondering if there was an optimal number, like of outcomes or things that make it easier to work with. We just talked about that, whether you go all out or if it's easier to focus on a priority number of them. And we threw out some numbers like 1 to 3, but we thought it would be good to bring that question forth to you.
So these are my biases as someone who's strategic plans, so feel free to challenge them. But I think on that impact side, which is the first question you're asking, even if we're looking at, let's say, Emma and her whole organization, I would say if I had more than 3, I would begin to ask myself, and we've seen this in the pilots, which are primary, which really add value to this strategic frame in this period of time. Because I think some have said to us, and we've seen people use the cards to say, these are primary. And if I really get these impacts, I'm going to see other things happening. But what I really want is these that are primary. And on the outcomes, I would ask myself the same question. I don't know if I have a magic number, but I certainly know if I saw more than about 6 outcomes, I begin to say, not that it's a set rule, but which are primary? Are all these truly primary? Or because again, we have to think about measurement, reporting, program design. So I think in a strategic frame, you're always trying to push to say, where are we trying to add value to meet the needs of our community members in the context that we're working in at this point in time. And sometimes the time frame might be short, but it may be 12 to 24 months. And I know we've seen in the pilots 1 or 2 people who want all 12. And as soon as we say, but where do you want to add value in the next 12 to 24 months, the list becomes down. But you've got to work with your group to really do that. And I think it will enhance an understanding of primary purpose or impact. Does that help, Jen?
Yep, I think that's what we were thinking. So just wanted to hear from the boss. I
have some strong biases, so people are welcome to to push on them. And again, I want to emphasize what you pick as an impact in June 2022 will not necessarily be the impact you would pick in June 2025. We are in a very dynamic world. So just see it as a tool, something you will use, come back to, refresh. So again, we're not trying to create some type of blueprint, or you're not locking yourself down forever and a day. You're trying to assess priority and focus for action to get maximum impact and outcome for older adults. You pushed the button, Janice. Shall I continue? No, sorry.
Well, no, but I also love the whole common language thing and, you know, the common outcomes. I mean, that's always going to make things so much easier. So it's really interesting.
So I know I'm going to see the red flag pretty soon because my time tells me we have 1 minute till noon. So Miriam, I think I should turn it over to you for the next parts of our process today.
Yeah, for sure. Thank you, Anne, for all of that. And thanks everyone for participating in that process. It sounds like most of you enjoyed it, which is awesome. So just before we break for lunch, actually, I just wanted to take the opportunity to invite everybody to a webinar that is being hosted as part of the Policy Futures Forum by the Alberta Association on Gerontology. It is tomorrow between noon and 1:30, and it is on improving the work environment for senior services workers. And I'm just going to put in the chat the link to where you're able to register if I can find my chat. So I'm just going to put that in there. And essentially the purpose of the webinar is to create public awareness of the senior services workforce issues that are based on research that certain researchers have done, not unfortunately on the community-based senior services workforce, but on other workforces related to senior services, and develop possible strategies to address the issues concerning all spectrum of senior services in Alberta. So these strategies would include facility-based continuing care, supportive housing, home care, and community-based services. And our very own Karen McDonald will be speaking to the issues that we do know are occurring within our sector. So if you would like to be part of that conversation and contribute to that advocacy effort and awareness raising effort, we encourage you to join. So that is a plug for that. And now it is lunchtime, so we will take an hour-ish for lunch. Yes, an hour. And for those of you who want to stay and network, you're welcome to. You're welcome to bring your lunch and just come back. We have created virtual lunch tables for you. So if you click on the breakout button at the bottom of your screen, you'll see that you're able to hop into these private spaces for whoever wants to have lunch together and have a chat. Or you can just jump in and then you might see who's wanting to network and chat. So just for those of you who will be stepping away, we will come back promptly at 1 p.m. And yeah, we hope that we'll see most of you back.
Miriam, I just wanted to check in, like what I see on the breakout rooms, there's a whole list, but you're only concerned with the lunch tables right now, right?
Correct. Yes.
Yeah.
So if you'd like to network, please just join the lunch table, lunch table breakout rooms.
Yeah, perfect. Thanks.
Thanks, everybody.
Hi, Miriam. I was just wondering if we log out of here, are we going to be able to copy this webinar that you put on the chat? You have like a webinar link there?
Yes. So, I mean, you can copy it now, but I can also paste it again. Yeah, I can paste it back into the chat just for folks that might step out and want to come back to it for sure. Thanks, Victoria.
Because when I try to log on, yeah, I try to get on it, it's taking me out of the meeting. So I don't know if I can say.
Oh, that's odd. Okay, maybe because it's a Zoom registration link potentially. Okay. I think you should.
Anytime it's telling me telling me that I'm leaving the meeting. So I don't know. Maybe
Okay.
there's another way for us to get it.
Okay. How about we will email it to everybody during the follow-up. That's interesting that it does
Sounds
that.
good. Thank you.
Thanks, Victoria. Thank you for flagging that. Yes, please don't leave the meeting.
Yeah, I tried it 2 times and it's like telling me I'm leaving the meeting. So, and I don't want to leave the meeting.
No, for sure. Thank you so much.
Organizational layer to the regional layer and beyond. And this sector map can be considered a multifunctional tool for service providers in the sector. So I'll just run through a brief overview of what Marla and I will be going over in the next 40 minutes or so. We will define the systems map and explain how it was developed with community. Then we'll give an overview of the functionalities and benefits, as well as how to use our systems map. And finally, we can look towards the future and how we expect to see the map evolving over time. So I'd like to start off by providing a definition of systems thinking, as it is the basis of how systems mapping acts as a tool. While there's not one single definition for systems thinking, at its core, systems thinking is a way of approaching or thinking about complex issues. And for us to be able to practice systems thinking or do systems mapping, we must first understand what a system is. According to Donella Meadows, a pioneer of systems theory, a system is an interconnected set of elements that is coherently organized in a way that achieves something, whether that be function or purpose. Additionally, an element of a system can also be a part of another system. And for this reason, we recognize that systems do not exist in silos. Systems theory recognizes that all these elements are connected or disconnected from one another in some way. By understanding these relationships, we are empowered to change the system as a whole. This was the basis of how the CBSS systems map was conceptualized and created. Similar to systems theory, there's no single definition or understanding of what constitutes systems mapping. However, generally speaking, systems mapping is a tool that creates a visual representation of a system to help name and identify the different elements of a system by explicitly showing how the system works and interacts. By gaining an understanding of the relationships between each of these actors, the sector as a whole can work towards broader systems change. As seen in this photo, the black circles represent the elements of the system, and the arrows represent the relationships between those elements. Another important element highlighted in this image is the system boundary. Identifying a system's boundary can be complex, but is a necessary step in framing the scope of the system. A system's boundary will help define who and what are involved in the problem and the solution. This boundary might be geographical or could define the level of specificity of the system. So are we examining an issue from a program level or an organizational level? I want to take a moment to show you a brief overview of what's been accomplished in the past few years. In 2019, we heard from community that there was a strong desire to undertake systems mapping and to develop a stronger understanding of current programs and services. In 2020, systems mapping was identified to be an integral piece of the initiative's roadmap, because by virtue of mapping our sector, we're also building a sector together. In 2021, we were privileged with Mara Steiner joining us as a consultant to kickstart this systems mapping project. She conducted a thorough literature review and designed and distributed a systems mapping survey to 1,938 contacts across the province. These contacts were compiled using existing contact lists from different databases, including the 2019 CBSS Sector Engagement Project contact list, Core Alberta's email list, the 2018 Directory of Alberta Senior Centers, and 211. One of the project goals was to find new contacts because we wanted to ensure that this map would be as fulsome as possible. And through this systems mapping process, we identified and contacted 163 new organizations and 40 primary care networks. All contact organizations were given the opportunity to register for a Zoom engagement session to learn more about the project, about systems mapping in general, and engage in a discussion about the direction of the project. It was critical that every step was informed by community. We were ecstatic to see that community was eager to learn as well as contribute their valuable knowledge, insights, and expertise. Out of the 20 optional sessions, 15 engagement sessions were held. In total, the systems mapping survey saw 359 total responses. One of the primary goals of the survey and engagement sessions was to better understand what senior serving organizations and allied partners would like to see from the systems mapping project. So on the next slide, you'll see the following themes emerged as discussions were held and survey responses were analyzed. The first theme shows increased connection and coordination. Systems mapping will help organizations identify and connect with one another, laying the groundwork for increased coordination and partnership between organizations within and outside the communities. One survey respondent shared that it would be beneficial to understand who was doing what and how programs and services interact and could align on initiatives. And the second theme shows identification of service gaps and areas of duplication. Systems mapping will help organizations and stakeholders identify where service gaps and areas of duplication exist at a community and provincial level. It's also important to note that there might be replication opportunities as we learn from each other and see where we can replicate successful programs to better serve seniors. So another survey respondent shared that I believe systems mapping can assist with identifying how all the supports that serve a population can work in collaboration. This can maximize the use of resources, address barriers to service, and identify and reduce gaps in service. The third theme that emerged was improved systems navigation. Systems mapping will help increase the visibility of organizations to other senior serving organizations and stakeholders, while also improving systems navigation and referrals within and between communities. A third respondent shared, navigation of community supports is a common theme that healthcare providers find challenging, as there are so many community organizations providing services. We employ navigators for this, but it would be nice to have a resource to consult. And the fourth and final apparent theme was benefit to stakeholders. Systems mapping will benefit stakeholders and allied partners as it presents opportunities. For example, to build stronger relationships between care providers and community-based services. Additionally, with a visual representation of the sector, stakeholders and partners from other systems like government, housing, and health can share a mental model and better understand what community-based services are being offered and how all of us play a critical role in healthy aging. And quoting another survey respondent, coordination of services across the health and social services sector is a critical and appropriate care and is critical to appropriate care and can significantly improve health outcomes as a lower cost to the system. We wanted to spend a few minutes explaining how the system mapping came to be because it is important to us that we communicate transparency and how you all have been a huge part of this systems mapping work. For this tool to be useful and ever evolving, we are dedicated to building it alongside the community. Please know that we welcome any and all feedback. The themes that were covered informed the building of the map, and soon we would be happy to share some of the uses of the map. The last piece of this timeline here is 2022. So we're excited to add layers to the map and build it out further. With your partnership, this systems map is not a snapshot in time, but it's growing in real time, and it's morphing and evolving to the needs of the sector. And with that, I will pass the virtual mic over to Marla so that she can show us how to use the map.
Thanks, Lauren. So when we kind of reflect on our session this morning around the Healthy Aging Framework with Anne and together in the workshops, we know that we have a shared mental model with the Healthy Aging Framework, a way of articulating and showcasing the valuable work being done across the sector, using the common language of the framework, and as well the 6 determinants of healthy aging that you see here on the slide, to align organizational goals, programs, and strategies into those larger buckets. One benefit of the systems mapping acting as a connection tool is that we have the healthy aging framework as a shared framework layered onto the systems map. When you look at the systems map, you're able to see what other organizations in your area are targeting similar determinants of healthy aging, or which organizations are targeting the ones that you don't focus on. That way you can find complementary and aligned strengths. Although organizations may have their own interpretation of the broader system, having a systems map and a shared language allows members to have better alignment in their understanding of the system and where they and other CBSS members align or can close gaps. So when your organization is placed on the map, it illustrates their place within the system with some key components. The first component is your organization's circle or bubble. So as you can see here, we have kind of an aqua colored bubble, and it might be a little bit hard to read, but that is the Grand Prairie and Area Council on Aging. That also corresponds, you can see a little line that moves across to a triangle labeled north. So that tells you which region or AHS zone that you are located in. Or it could also be provincial in scope. We have some organizations that, such as AHS, that offer services across the province. The outline colors that you see bordering that aqua bubble, so we have a blue, a green, a pink, and a red kind of semicircle pieces, those are showing which determinants of healthy aging your organization aligns with. So not every organization would be offering determinants of healthy aging on all of them. It really corresponds to what your service delivery is about. And the lines, so that one line that I referred to, illustrate the connections both to your zone that you are located in, and then the connections that you would have between and with other organizations. Now we can start to look a little deeper and find some areas where you could create new relationships, for example, scale work already being done, or even identify some gaps in the sector. For example, do you want to write a grant and maybe you're looking for a partner? You could look on the map, see who you're connected to, and find some synergies across those determinants. Are you thinking of creating a program around the determinant of healthy aging of safety and security? You could first look to see who else in your region already has that determinant in their program delivery, and that way it helps make sure that you aren't duplicating services. Or you may even have some ideas around strategic goals for your organization and want to see who else has similar determinants of healthy aging, or conversely, where there are gaps in the system that you can look to fill. I'm just going to stop on this slide here for 1 second, just to explain this visual a little bit. You can see on this slide, we have a red bubble in the center. So this particular color is associated with the South Zone. And all the lines that are emanating from that central bubble are illustrating to you organizations that are tied in some way to that central organization. So that level of relationship could be referrals that maybe are going between organizations. It may be a partnership or a collaboration of some sort, but that they have told us that they have a relationship with multiple organizations, and we reflect that on the map. Thank you. As you broaden your view of the map further, now this image gets a little bit tougher to see, but as you move out from your organization, so you see who you're tied with, then you see the region, and you could look at the whole province, an overview of the whole province. You can see beyond who you're directly connected to or those first level of connections. And then the next level is to see who those organizations are connected to. So moving to a second level of connections. This may offer your organization or others an opportunity to introduce themselves to new organizations, create new partnerships, and some new collaborations. So this is where the development of a constellation network really begins. An organization's place in the systems map moves outward from a local to a regional level, and perhaps even expands across the province, ultimately helping to shape the full community-based senior serving network. Understanding your organization's place in the systems map alongside other organizations allows you to see the ever-changing scope of work being done to develop the sector, as well as strengthen the work that everyone is doing. That could be breaking down silos, helping to minimize redundancy, and building capacity to strengthen the system as a whole. So now I'm going to turn to each of you again in our larger group, and we'll just do a quick activity. So a few slides ago when I talked about organizations that you may be connected to. So if you think of, 2 or 3 organizations that you're currently connected with, then if you take it to that second level of organizations and think about who they are connected with, I'm going to ask for some brave volunteers to think about that second level of connections. So for example, if you had mentioned, let's say you're a senior center in your region and you might be connected to a meal delivery service, who might that meal delivery service be connected to? So do we have anyone that wants to kind of talk about what that, what those connections might look like and what that might mean when you're trying to build some new relationships or perhaps look at some program delivery that you might not be yet connected to? Anyone that's willing to offer some on the ground examples for us to chat about? And you're welcome to put things in the chat box or just speak out. Do we have any brave souls?
Kim has her hand up.
Oh, perfect. Hi, Kim.
Hi. I just wanted to share, when we were advocating for caregiver access to loved ones in long-term care, we kind of wanted to find out who else was experiencing problems with that during the pandemic, and ended up, this would have been amazing to use as a map to find places like hospices or other organizations that we're not kind of directly connected to, but peripherally we certainly were. So that would have been a great help.
Yes, that's a great example. And if your information is in the map now, or if you want to expand on that information, the more information that we're able to gather from organizations, then the more robust that information becomes, and it allows you to kind of reach out and see further beyond your kind of regular network, shall we say, and look at those new opportunities that might be out there. So yeah, that's a great example. Thank you, Kim. Do we have anybody else that's thought of an example that would be applicable to their organization or their region?
We have Jody is commenting and saying, I think your meal delivery example is a good one. Meals on Wheels might be connected to home care and hospitals, which could connect a seniors organization to same.
Yeah, that's a great one. And certainly, the issue of food security is large in the minds of many seniors and organizations that are working with them. So ways that you can kind of be connected within that broader scope of an organization like Meals on Wheels, absolutely, can be very, very beneficial. certainly in the scope as well, I was chatting with an organization the other day that was able to connect with home care and ultimately provide some volunteers that were able to do some meal delivery in a region they hadn't actually been providing service to before, in the southern, just sort of south of Calgary area. So there are opportunities that you may not necessarily think of, as we're all busy trying to get done what we need to get done. But the map is a useful tool to be able to kind of look beyond the scope of where you normally would. Okay, thank you, everybody. And then another question, I mean, now this might be a little more directed to people that have seen the map or put some information up onto the map. And we will get to looking at that together a little bit in a minute here, but can anyone offer some ways that they think the systems map would be useful to their organization, complementary to the work that they're doing? When you think about those relationships and the determinants of healthy aging that are tied in.
Jan has her hand raised.
Hi, Jan.
Hi. So it's definitely helpful in around case management and referrals.
Yeah, that's excellent. And I think, when you're looking at helping the clients that you are working with or any other organization is working with, the opportunity to open those doors to more access, right, to referrals that are relevant to the older adults that you're working with is absolutely critical. Thanks, Jan.
And you have Sharon with her hand raised next.
Hi, Sharon.
Hi. Yeah, we've just in our Connecting People and Community for Living Well work gotten into the use of that mapping kind of concept in the work, and certainly find it helpful. I think one of the mysteries or myths surrounding community-based work is that it happens naturally. And that it's really easy to do. So one of the things that I think is most powerful with it is that visually then you have represented everyone that it takes to support people in the community, which is so powerful. It's sometimes there's a difficulty in evaluating this type of work. And I think this is a really great kind of qualitative artifact that helps to tell some of that story.
Oh, that's great. Yeah. I think we feel the same way, right? And so it's nice to kind of get that confirmation and that sort of feedback. Yeah, it is. So, there are other maps out there, and we are not in any way trying to replace, other work that's been done. But this one is unique in the fact that it is showing those connections and relationships. So yeah, thank you. That's a really great feedback. And just for everyone who has been exposed to the map or would like to be exposed to the map, we certainly welcome all feedback. So we're always looking to make it better because it's ultimately all of you that are using the map. So we appreciate all the feedback that you can give us. So thank you for that.
We have a couple comments in the chat, and then we have Benita with her hand up. So in the chat, we have Susan. Being independent living, it'll be helpful to see what others have on the go for mental wellness and contacts for activities. Through finding these things out, one normally finds out other beneficial information as well. And then Jody says, I could see more collaboration on social activities, perhaps, especially sharing virtual options, linking with organizations that serve populations with barriers, example, like the Indigenous populations. And then Yvonne has, this model is used to identify community-based development, asset mapping per asset, skills, knowledge in each sector. And then we'll go on to Vanita because she's been patiently waiting.
Okay, thanks for all those comments, everybody.
Yeah, I just wanted to mention that when a client walks into our office, the client might have a diverse set of needs, which one particular organization might not be in a position to justify while helping. So this would be really helpful in connecting the client to the right resources and to proper referrals.
Yeah, thank you, Vanita. Absolutely. And you know, I think we can all relate to as well when, you know, you're kind of used to your regular network and you understand where to send clients to, but you know, it's hard to keep abreast of everything, right? And so there might be an organization that's offering a program that you just weren't aware of. And so to be able to kind of quickly check within the systems map and understand, hey, there's an organization I wouldn't have thought of. And now you have you know, greater accessibility for your clients.
Yeah, Victoria with her hand up next.
Hi, Victoria.
I think you're muted, Victoria.
No, you still can hear you, Victoria. It doesn't show that you're muted, but you don't have sound. Do you want to type in the chat and I can read it for Marla? No, still nothing.
Okay, maybe we'll go to the next slide, which has the tutorial video, Marla, and then we can loop back to Victoria if she gets her mic working.
You bet, you bet, yeah. So now we have a little tutorial video. So this will show those of you that haven't yet been exposed to the systems map, kind of a brief introduction to what it looks like. You will see a few of us on there, and hopefully this piques your interest, and then we'll reconvene after the video is finished.
Hi, so I would really like to be part of the systems map, but can you give me a tour first?
Absolutely. Let me show you what the map looks like in detail. You can find this map on cooler.io, and it can look a little overwhelming at first, but this speaks to the complexity of the community based turtles. Is that cutting out on everyone? Can everyone hear that?
There's no sound.
Okay. Let's see if we can try and rectify that.
I can try it on my end, Miriam, if you would like.
For sure. Might be my internet connection.
Okay. Let me see if this works.
Thank you for your patience, everyone.
Yeah.
Hi, so I would really like to be.
Maybe that's a good idea, Jody. Going to turn off our cameras just briefly to see if that helps, but we might need to send this out by email for everyone. Hey, Cindy, I'm going to try one last thing. And then if it doesn't work, we will move on.
last hopes in you, Miriam. Hi, so I would really like to be part of the systems map, but can you give me a tour first?
Absolutely. Let me show you what the map looks like in detail. You can find this map on kumu.io, and it can look a little overwhelming at first, but this speaks to the complexity of the community-based senior serving sector and how diverse it is. On the left side of the screen, you will see a basic description summarizing the purpose of the map and an overview of what is illustrated. Connections and relationships between organizations are shown on the map. And interestingly enough, we are currently the only map that showcases relationships. If you want to have a wider view of the map, click the 3 circles here and the view will expand. The legend here will guide you through. Much like your regional community developers or RCDs, organizations are also divided by AHS zones, and each zone is noted by a different color. The bottom half of the legend details the determinants of healthy aging, and this is based on a tool called the Healthy Aging Framework. Organizations may be offering programs or services that meet one or more of these determinants.
Sorry, quick question, but who are the regional community developers and how might I contact them?
Yeah, to support CBSS organizations to build a successful network of collaboration across the province, Healthy Aging Alberta has a team of regional community developers, each one of them assigned to a dedicated zone in Alberta. Based on where your organization is located or where the main services are delivered, the RCD for your zone will reach out to you to establish a direct communication channel. As we expand our work across the province, we are adding more community developers, so the team can assist you if your zone doesn't yet have one.
Oh, okay, I see. And sorry, another question, but what are the determinants of healthy aging and the healthy aging framework?
That's a great question. On our Healthy Aging Alberta YouTube channel, we have a high-level overview of what the framework is all about. But in one sentence, it is a tool that can help us have a shared language to articulate the existing work we do and the collective impact we have through shared evaluation indicators. Let's return to the systems map and I can show you an example. You can type in your organization's name here. We'll use FCS's Parkland County as an example. The map will zoom in on the organization that you have entered. On the right side of the map, you will notice a focus button, and that will isolate your organization. The up arrow button right above will expand the focus, so you can see all of the other organizations that you are connected to, and that is where the magic happens. These connections are created based on the information that organizations are sharing. We want to make sure that this map is as live as possible and not just a snapshot in time. So our regional community developers will be supporting that by capturing and adding the connections.
Hi, your regional community developer here. So at this individual level of the map's focus, you will see the organizations that you're connected to and the determinants of healthy aging that those organizations and you are meeting. Maybe you don't have any determinants around safety and security, but on the map, you can see that your local library does. You call them and find out that they offer a ton of support teaching seniors about online safety. Now you can refer your clients to them for that service instead of offering it yourself and having redundancies and services in your communities. It's a great tool for you to use. Organizations that don't have the determinants represented here just means that they have not yet shared the information and our RCDs are in the process of connecting with them. Organizations also don't have to have all 6 of the healthy determinants of healthy aging, only the ones that you apply to your services or programming.
If you click the up arrow on the right again, we will get onto the second level of the map. And from here, you can see pathway to relationship built with those who are in your zone or region, as well as relationships that extend outside of your zone. Perhaps, for example, you want to pursue a grant and you see here that SAGE has similar determinants of healthy aging as you do. So you can reach out directly or ask the common connectors such as SAFE for an introduction as you are already connecting to them. And if you see an organization on the map that you are not familiar with, you can click these 3 dots here on the left and their profile will expand. Once again, this information was provided by the organization and it is really helped us have a fulsome map.
That's super great. I can see how this is helpful to see how I'm connected to other organizations beyond who I connect with regularly. It's nice to see that there are others doing similar work that we could possibly collaborate with. How would I get my information up there?
We have a simple form that you can fill out telling us the information you would like to add or revise. Once we receive your response, we will upload it to the systems map. Organizations are also welcome to connect with their regional community developer, and they can support you in getting your organization represented on the map too.
Awesome, that's groovy. I'll fill out this Microsoft form. Thanks.
Awesome. All right. Okay, so that worked. Took us a while, but we got there, folks. Thank you for your patience. Yeah, so thank you, Lauren and Marla, for that. So as shown in the video, the tool gives you the ability to use the systems map in layers. So as we continue to work on the systems map throughout 2022 and beyond, we want to add more layers to the map to make sure that the information is a bit more relevant and can really support folks' strategic planning and collaboration planning and sector development work. So for example, we see the potential benefits of adding a layer to the map that highlights funding pathways. So just information that can help identify which funder is funding what type of work, or what organizations are connected through what funding sources. And this can help funders see where there might be some gaps. And it might help inform some of those funding decisions, as well as help give people ideas in terms of funding streams that they might be able to pursue. One of the strategic objectives of Healthy Aging Alberta is to advocate for appropriate and coordinated investment in the sector. So we know that this is an important layer and an important piece to map for our sector, for us to understand as a sector, as well as for our systems partners to be able to understand. The other piece that we have identified as a potential useful layer is around home supports or home and community supports. So those non-medical supports that allow seniors to, or enable, I should say, and empower seniors to continue to age in their own communities. So there is a big interest in the province and in our sector in kind of understanding what exists. So adding this layer, I would identify organizations that are providing those types of supports. And we would also be able to develop as a sector a definition for what we mean by home supports. As we know, we've been talking throughout the day about common language and a common mental model so that we can really understand each other as we're attempting to further expand our collaborations and build the sector. So really having a clear definition around what we mean by home supports and sort of aligning that to a provincial model for home supports delivery would be beneficial to our sector. So that is another layer that we are sort of in the process of thinking about how we could add to the systems map. And of course, as the team mentioned, if you have any feedback or thoughts on what additional information would be useful, we would want to hear about that from you and do our best to incorporate over the course of the development of this map. This will be, as everyone mentioned, a live map that we hope will continue to be developed. And for now, it is a free tool that is accessible to anyone. So we hope just to continue to evolve it with everybody's feedback. And now, so I'll thank Marla and Lauren for that, and we will move on to the next portion of our agenda. And we would like to invite, again, is Karen still with us, or did she have to step away?
Oh, I'm here.
Oh, hi, Karen. Sorry, I wasn't quite sure.
No, it's
great.
good.
Because of the way that I'm sharing things now, I can no longer see folks. Just to enable video sharing. But Karen will help guide us through a facilitated conversation about priorities, which was mentioned earlier on the day. So I'll pass it to Karen.
Yeah, thanks. I turned off my camera to help with bandwidth and then completely forgot that I'm nodding enthusiastically to everything Marion was saying with my camera off. So not that helpful. Yeah, no, thank you for that really great conversation with system mapping. I loved how everybody tag teamed that section of our agenda. That was really enjoyable. I hope everybody else enjoyed that as much as I did. It's great to see these projects come to fruition in such a really dynamic way. So I hope that everybody has been thinking in the back of your mind all day today about the priorities for the sector in your region and across the province. I'm going to invite you to answer some questions through the Mentimeter. I don't know if anybody's used this tool before, but it's a way for us to be a little bit more interactive in our work together today. So I think Cindy's going to put the access link for the first question in the chat box. So once you click that link, you'll be able to type in your answers to the questions. Your input is going to inform the strategic direction for Healthy Aging Alberta for this initiative. And the themes for the Healthy Aging Summit that we hope to host and that we'll conduct over the next year, hopefully soon. The first question we're posing to you is, what are the priorities that you hope Healthy Aging Alberta will focus on over the next 12 to 24 months? And you'll recall over the history of Healthy Aging Alberta, even before it was called Healthy Aging Alberta, that through various forms of consultation, your feedback has informed the priorities of our work. So this is a really important question. So I hope you take the time to click on that link and enter your feedback through the Mentimeter. And then we're going to spend a little bit of time. I think I have 5 minutes per question, Cindy said. So get to spend a bit of time having a conversation. And I noticed, I thought we were going to finish that last section of the agenda quickly, but we didn't, because you guys all turned on your camera and your microphones and engaged. And so I really appreciate that. So I'm hoping we'll do that again. So tech support is going to share the Mentimeter screen and they're going to help us see the answers. Just trying to look at
they're popping on right now.
Look at that. So isn't that neat, you guys? So you're going to start to see some of people's answers here. So connecting folks, addressing the needs of equity-seeking seniors, system navigation and seniors' mental health and wellness, disseminating an awareness of resources, caregivers and navigation, preparing for possible COVID variants, oh boy, and impacting older adults, 100%, system navigation and collective impact, mental health and wellness, creating a forum to do advocacy, system connectivity. Oh, people are popping things in the chat as well. Meals on Wheels, better quality, transportation issues since COVID, bus service in rural communities, awareness of resources, system advocacy, home supports for the most vulnerable of older adults, advocacy for services, financial supports, 100%. Keep compiling resources groups, generally grow the content of CORE, right? So people have been engaging on CORE, good news. Planning tools for advanced care planning. Yes, we've got our Covenant Health colleagues here today. Planning tools, rural issues, lack of some services, right? Equity across the province, not the same as it is in rural remote communities. Support for caregivers, our informal caregivers are such an important part of the lives of older adults. Connections, building a sense of belonging, mental health and wellness supports, that's come up a few times. One door, I'm guessing that means like any door is the right door, right? To access services that people might need. Promotion of training opportunities. So that's that whole workforce planning piece, right? Fewer silos between immigrant and senior serving organizations and Healthy Aging Alberta. Great point. That's definitely an area of work we need to focus on. Finding those seniors that are falling through the cracks, not online and isolated, 100%. So access to technology, the divide around technology. Education, so that might be education for the workforce, might be education in terms of lifelong learning for seniors, one-stop shopping for seniors and service providers, make this map of as fulsome as possible, right? So system mapping, develop the home support resources, provide education to enable as many groups, caregivers, and individuals to utilize the resources. So that's come up a few times, right? Education, access to resources, navigation, system mapping, we're hearing some themes. Valuing direct service delivery staff, increased pay and job security. Oh, see, I see themes around workforce planning. This is helpful for the presentation tomorrow. I appreciate that. Needs assessments. That's interesting. I'd love if people could expand on that. Is that in terms of the needs of organizations, the needs of seniors, the needs of staff? Engage healthcare systems to increase awareness of Healthy Aging Alberta work and how health systems can support the work of Healthy Aging Alberta, or support the needs of seniors. Organizations help with technology. So maybe in terms of how seniors use technology. It's also a bit of a technology divide in terms of nonprofit organizations and their access to technology. We know that's a concern. Funding collaborative efforts. So collaboration takes time. Yes, human resource time, 100%. Support funding for spaces for recreation activities to promote quality of life. Great point. Support funding for spaces. We got that one. Build the system with older adults, not top down, right? So centering our work on seniors. We talked about that as one of our core principles for Healthy Aging Alberta. So that's a great reminder. Advocacy with Government of Alberta. That's one of the things we need to talk about as a key priority. Advocacy to what end? What are we trying to achieve together? Create meaningful incentives to use system maps. Building the tool is no guarantee of use. Oh my gosh, right? And then how do we maintain it once it's there? Health systems is built around providers. Can CBSS do better at bottom up? Good question. How do we work together with that goal in mind? Is that about 5 minutes? How am I doing so far, Marla, for the first question? Are you okay? I can't hear you. Sorry.
You're on mute, I'm sorry. We have about 9.5 to shy in total till the end of the section.
Perfect. Okay, well, why don't we maybe move on to our next question? I just want to make sure we leave enough time to get through all of them. So the next question is, are there any opportunities or challenges that exist in your region that you think Healthy Aging Alberta might be able to help address or advance? So this is really this is a unique session because it's virtual. We have people attending from all over the province. What's unique in your area that maybe Healthy Aging could help support and respond to? It's going to be really interesting to hear more about. And I think one of the benefits of, for the first time, Healthy Aging Alberta is going to allow us to work collectively to address some of these systemic challenges across the province in a way that maybe we've not been able to before as a sector. So that's really exciting. So I'd love to hear more about the needs of rural remote communities or the needs of urban centers, how they might be different. Are you maybe part of an organization that is provincial in nature? How do we leverage that perspective? Better integration, less competition. So moving away from the idea that my way is the best way. Oh my gosh, I couldn't agree more. I'm so inspired by what they did in BC around their funding model. No more competing for funding. Imagine that. Building connections to rural municipal governments. Absolutely. Healthy Aging Alberta recently did a presentation to committee with the rural and rural municipalities. Was it, Barb? Remind me.
No, AUMA. So it was the urban municipalities, but that could be very small cities. That doesn't mean.
Yes. Thank you. Get those two confused every time, but still working towards our relationship with municipalities. It's a very important stakeholder in our work for Healthy Aging Alberta. We've also presented to the FCSS directors, which again, the relationship with municipalities, and also ASHA, Alberta Seniors and Community Housing Association. So we know municipalities and housing bodies, right? Important relationship there. Build up fall prevention and exercise classes, both virtual and in person. Excellent point. So fall prevention, we know is important to allowing seniors to age in their homes, right? Ensuring that people aren't moving prematurely out of their homes because of a fall. Connections with primary care navigators in primary care. How do we build that relationship? More investment in CBSS. Stop expecting CBSS agencies to move mountains with toothpicks. I feel like I could put that on a t-shirt. That's great. Accessible Housing Society in Calgary offers a service to individuals to make their homes more accessible, enabling them to stay in their current accommodation. Look at expanding this service province-wide. So what is the role of Healthy Aging Alberta to amplify those kinds of best practices? That's great. Transportation for seniors, right? We know that's always a big gap, a big systems gap. So how do we work together on that key service? While online might be easy for some, a news broadcast may be more educational for those learning new skill improvements. That's great. So different ways of communicating information. Older adults with disabilities, aging, so PDD, right, 100%. Older immigrant refugee adults aging out of place. Oh, that's interesting. Older Indigenous people welcoming into CBSS services. So those are all sort of transition points between different service sectors, and how could we maybe support those transitions more effectively, I think is maybe what someone's trying to say there. More mail out advertisements. So how, again, different ways of communicating, I'm guessing with older adults specifically, and maybe caregivers. If I'm misinterpreting something, please pop it back in there. More resources for 55 plus. moving integrated health and community services together, coordination between health and community-based services serving sectors. So that's a huge focus for Healthy Aging Alberta. I'm glad to see that that's popped up for people as a priority. Glad to see we're on the right track there as a priority going forward. Leveraging the free delivery of mental health first aid for supporting older adults training across the province. That was a priority that was announced with the funding recently by the Ministry of Seniors and Housing. So it's great to see that that's a priority for people. A friendly community-based advocate, someone that the community seniors know, look for local. So those sort of natural leaders within community, I'm guessing. More advocacy to address policy gaps for equity-seeking seniors. So maybe just really a better understanding of how we better serve seniors from diverse backgrounds. Maybe are there those that are experiencing barriers to service delivery. Presentations to and collaboration in service mapping to add settlement services, Indigenous health, and provincial healthy advisory councils. So really broadening the scope of our system mapping to maybe include some areas that we don't have right now, or maybe that we have underrepresented. Those are great flags for us to capture. Thank you. How are we doing, Marla? I see a yellow. Do we need to move on to the next question? Excellent, let's do that. Okay, we have one more question for the Mentimeter. We want to capture your thoughts. Last question. Do you have any other feedback or thoughts? So this is a nice broad question, not being overly prescriptive. Are there things we've missed, things you want to let us know about? Could be related to the future direction of Healthy Aging Alberta. It could be related to how we do engagement. Could be related to a summit to where we bring people together. In BC, they do a summit every 2 years where the community sets the direction for their Healthy Aging initiative for the next 2 years and reflects on the progress they've made for the last 2 years. It could be related to the projects we've identified that are underway. It could be related to getting involved. It could be, I don't know, that you really like the beautiful graphic design work the team's done. I don't know, could be anything. Let us know your thoughts. Maybe you want to get involved in something new you haven't heard about today that maybe we've missed. Oh yeah, please unmute yourself. Feel free to jump in. Who is not at the table today? Find them, get them here. Yes, please. It's so encouraging to see new faces and new names, but we are missing people 100%. And we need new advocates to go out and share the word, right, about this important work. It can't always be the same people talking about it, or it's a bit of an echo chamber. So I couldn't agree more. Such lovely presentations. Well done to the core team, 100%. Congratulations to the team. They always do such beautiful work. You guys have done amazing work in a short time, very difficult conditions. I think that is a universal truth for the sector. So congratulations to everybody on the call today. It's been a difficult few years. So couple, it's just all blending together now. Understandable language, not equity seeking seniors. That came out in my small group that I was in. So language is important. We spent a lot of time talking about that at the Community Leadership Council table. The language you choose really matters. So I appreciate you flagging that. So the word equity seeking, it can be still a little bit of a disagreement about whether or not that's the right terminology. I agree that a summit would be a worthwhile initiative. Also, there is a need at both the provincial and federal level to provide adequate funding to enable seniors' homes to accommodate aging in place. I'm surprised that's the first time the word funding's come up. Could we just like throw that word out there more often? It's the resourcing in general, right? How do we resource this work? How do we support the capacity of CBSS organizations to deliver these services? I really appreciate somebody mentioning that. And some interest in a summit. Obviously being here together today, even virtually, is really energizing. Maybe not for everybody. I feel pretty energized. So what would it mean to be able to come together with everybody at all of the regional gatherings? There's been, this is our 4th. So lots of really exciting relationships being built and learning happening. So bringing them all together would be kind of exciting. Does anybody want to share anything verbally? Not in a Mentimeter? Maybe that's not everybody's jam. No? Thanks, Sharon.
Can anybody hear me now? I don't know.
Yeah,
Hello?
Victoria, you're breaking up a little bit, but we can hear you.
I Okay. Well, I was gonna say you guys are doing amazing. This is awesome. Like I didn't expect that something like this would come alone. From being CRA, they can just like so do. But is it
for everybody?
One quick wanted to add to this. Have like can we make a referral for from him to bring in more senior programs?
Victoria, sorry to interrupt you. Maybe try turning off your camera because we can't make out what you're saying. So if you turn off your camera, we might be able to hear you.
Oh, try that now.
I'll try that again. So I was gonna add that here. Is it working now? Okay. I was gonna say, well, I already said that before, that keep up what you're doing. This is amazing, and it's good to have a team like this. Other than that, I'm a member of the CTRA, the Canadian Therapeutic Recreation Association. I always felt alone, but knowing that this is happening and we have something like that that is like a support is amazing. So I have one question I wanted to add to this. Can we have like a referral for some of the seniors to be like, get out, get engaged, even though I already started something within here and talking to people, going to them to encourage them to get out to do activities online and even going to their houses to help them plant and stuff like that. But if we have something like a referral that could encourage more of them to participate in recreation activity, when we know that it can actually make people feel better. So I don't know if there's anything like that, like a form or a kind of referral that could come from, if they see the name, health and aging group, encouraging baby boomers or seniors to participate in programs, maybe to make them feel better to join in activities. So I don't know if we can come up with something like that. I didn't finish up the typing when I was writing that. So thank you for all you're doing. It's amazing. Keep it up.
Thank you, Victoria. We heard you perfectly. That worked really well. No, those are great ideas.
Oh, okay.
And that actually echoes some of the feedback we got at some of the other sessions as well. So we can take that back to the group as well, that whole piece around like connecting and facilitating like the community of practice around the recreation piece. That's come up a couple times. And one of my key takeaways from what you just shared, right, is how do we connect on that particular topic and share information with each other? I don't know if others want to add to that. Does anybody else have any thoughts?
I was just going to say to Victoria to please connect with us just so that we can see if there's anything on core that we could potentially activate. There are, as we mentioned earlier, several groups that are already active. So just trying to take a little bit of time to kind of brainstorm around that piece in terms of encouraging participation in recreational activities and what could be done at a provincial level or at a regional level. So let's connect offline and see where we can take that, Victoria.
Okay, thank you. Okay.
And there's some additional comments there in the Mentimeter as well. Miriam, was there additional comments? Before the break?
Yeah, I think there were just a couple of additional comments that were added, but we stopped sharing because I think we're out of time. That's our cue that we need to move on. Well, thank you, everybody. Thank you for all of that. And now we are going to give you a little break. So I'm just going to put up our little break slide here. And we will be back. I believe we're going to take 10 minutes. Can we still do 10 minutes, team? I believe we're still okay to do the 10-minute break. Oh, am I sharing the wrong thing again? Sorry about that.
Nope,
there we go.
It looked good.
Oh, sorry. Yes, we are exactly on time for our break. So we will be back at 2:10. I'm just going to see if there's any other prompts that I need to give you. No. So once we are back, we will jump into our conversation cafes. So get ready for that, and we will have some instructions on how those will work. So please be back at 2:10. Thank you so much.
For some of our conversation cafe speakers that need to prep, please stay on and I'll help facilitate that. So I see Jen. Hi, Jen. I like your background.
I'd like to see
Hey,
what it
Hannah and
is.
Megan. So I'll move you into your cafe room 4, and then Maylee can do prep with you. So I'll just move you there right now.
I don't know how to change my background, so we'll leave it.
Oh, no worries. It's so fun.
Yeah.
I'll put you in there. You should get a prompt.
Okay.
And then Hannah, you next. Let me just find you on the list. There you go. And then Megan. And Anita, you already prepped in the morning with Lauren, but did you want to do it again, or you can take a break now if you want to? Okay. I think Erin is in with Kim and Kim, so we're good.
Very excited about them. It's me every time. So we've created 6 breakout rooms for you to choose from. So we will have 3 rounds of 20 minutes each. This will mean that you will be able to hang out in 3 of the conversation cafes, or 3 different ones. So this is a great opportunity for you to share and learn about promising practices that are emerging and being innovated across the province. So we will keep time, and we will let everyone know as when the round is over, so that people can move to the next to their next conversation of choice. There will be a signal just when the round starts, and then just some prompts as we go through. So we will walk you now through how this is going to work exactly. So just one second here. And you'll see here that we have a list of the available conversation cafes just on the bottom there for you. So you can choose the next conversation cafe by clicking the breakout rooms icon that's at the bottom of your screen. This will bring up the list of breakout rooms. So you'll see them 1 to 6. And then you can just click join. So when you've joined the conversation cafe of your choice, if you see that there are more than 25 participants, I don't think we'll have that issue. But if you see that there are too many people, please maybe choose another conversation cafe, just so that we're well distributed, and you will still have the ability to go back to that presentation in the next round. Lastly, we just ask that if you popped into one conversation cafe, unless it's really full, which again, I don't think we'll have that issue just because a few people have dropped off. But that you stay in that conversation until the round is over, just as a courtesy to the presenters. Does anyone have any questions about this process? Did we already lose some people?
People seem to be excited and headed into their rooms.
Amazing. Okay, well, maybe then let's just get going. And someone will be putting prompts in the all broadcasts for us for timing, so we can jump into our conversation cafes and get started. Thanks, everyone.
If you find that it's difficult to move into your cafes, just let me know your preference and I can move you.
Cindy, will you put me in 6?
Okay.
Thank you.
We're texting you now. Just gotta find your name. Move to 6.
And where does the cafes come up? Sorry, guys.
No worries. If you click the breakout room button, a list will pop up.
I'm not seeing the breakout room on my screen.
Okay, no worries. If you look in the chat, I've listed the cafes there. Mm-hmm. Which one would you like to go into?
I'll do Cafe 2 for now.
Okay, moving you to Cafe 2.
Thanks,
Should
Cindy.
have a prompt. No worries.
And for Linda Saunders, Cafe 2 as well.
Okay, doing that now.
And Ralph Hubley as well. Okay.
Okay, there you go.
Thank you.
Welcome.
MJ, Cafe 2 as well.
Okay, Cafe 2 is popular. You should have a prompt, MJ. Ingrid, Cafe 2, doing that now. Any more wish lists? Ingrid, I think on your end, you need to click yes. There you go. I'll pause this. I'll click recording now before I forget.
I was the only one in the last session.
Oh, were you?
Yeah, so I had very, so one of the things I learned, because you know what, I'm a senior that services are being directed towards, and I actually thought that this whole session about healthy aging was for people like me and not for the agencies. But it turns out it's all for the agencies, and so agencies are talking to each other. But it's all, you know, so they're talking about each other, but I'm the one that they're talking about. And it's about us old ones. And so I kind of want to be involved what they're saying about me. So that's why I've joined up. And I think Bruce there, he looks like he's got a bit of gray hair as well. So
What's
he may
left?
be, he may be in my category. I'm saying, Bruce, that I was the only one in the last session, and it appeared to me, became apparent that this whole day today, the core Alberta agenda on healthy aging was geared towards the agencies. And I actually thought it was geared towards those of us with gray hair.
Yeah, well, I guess we can benefit from it. We can provide some advice to the agencies that are here.
Well, that's my intent,
Yeah.
if they want it or not.
We definitely want it, Linda, and we're glad to have you and Bruce here. We were talking to Bruce. Bruce was saying, I don't do anything, except he is so busy doing a million things, as I am sure you are as well.
Yeah, you bet. Today's a rainy day here, so I could have went to the seniors drop-in center and had pie. But my husband's a bit arthritic, and he just felt like staying home in his recliner covered with his blanket.
Well, and it's to our benefit because you're here. So thank you. And I hope this weather passes so that you can get out there again and get some pie.
I'm just hoping it doesn't impact Calgary too much and surrounding area.
I went to check my window well because the rain was getting into my basement. So I don't know. We'll have to see. We're right by a river, the Elbow River. Obviously, we're close to a park here, Saltfish Creek. So I'm hoping that nothing happens and we don't have to get evacuated or anything like that. But
the rain is a godsend up here in northern Alberta. Things, the crops are starting to wilt. So we really needed rain up here.
Yeah, no, that is the piece, right? And you think about other parts of the world. I think about this country. I lived in desert countries where there is water is hard to come by. And I just, every time I marvel, I'm like, there's so much water in Canada. It's just incredible. Anyway, sorry, off topic. We will get back to our agenda and wrap up so that folks can move on with their day. So we have, hopefully everyone enjoyed the conversations, and we have some closing thoughts for you, just that we would like to share. I'm going to try to share properly this time because we do have a last video that we want to share with you. So bear with me here because I can't see people anymore. But we just want to leave you with some closing thoughts. So as we end our day, we just want to share a spotlight video that we've put together that just shows a really heartwarming mother and daughter duo that have been involved with championing seniors' issues in their respective networks as core group leads. So we want to make sure that we made space for you to hear directly from them and their story with CORE and with the Healthy Aging Alberta initiative and just the impact that the work has had on their work. So if you bear with me here, I'm just going to play this.
It's all the growth and all the work that we've done over this past year, right? We're building momentum and we're getting recognized. And because of CORE, we're able to reach so many people effectively and financially responsibly. Because our presenters aren't charging us and CORE does not charge to register or share. So it's invaluable in how we are sharing resources and information and networking. There's lots of networking that goes on. You can see the chat just flying when presentations are on. People are connecting with each other, but also with the presenters. So they're able to follow up and get more specific help on specific situations they're dealing with.
For sure. And I feel like with both of your groups, there's a huge commitment to creating that like sense of community, sense of belongingness, where people feel comfortable like connecting with one another and like forming those relationships after the event. So that's like really powerful in terms of community development, creating new like innovative programs as we like collaboratively problem solve and share ideas and stuff like that. So you two have been a huge part as along with your group in kind of bringing the CORE platform to life. And yeah, we can't thank you enough for your hard work. So all mushy feelings.
Thank you. Hopefully everybody. Oh,
it's all the growth and all the work that we've done.
Sorry, my bad.
Past year.
There we go. Okay, hopefully everyone was able to see that. Yeah, so the full video is available on the Healthy Aging Alberta YouTube channel. If you're interested in watching that and meeting Bonnie and Colleen further, and I believe Cindy will be putting that in the chat. So something else we wanted to share was one of the things that emerged out of the core groups this past year was the determination to work together to broaden professionals' understanding of seniors' issues and how they connect to one another. With this holistic approach, the Core Frailty series was born, bringing together 5 unique and varying perspectives on frailty. So each participating group brought areas of expertise to the series while seeing their work intersect with one another. I just need to scroll through my notes. And apologies for that. So these are some of the survey results just from the frailty series that are on the screen that just speaks to the value that this collaborative effort brought to people and the importance of seeing the work intersect together. So we hope that you've had a valuable experience with us today and that you will stay connected to this work. And
it's all the growth and all the
sorry. So we hope again that you will stay connected. So please, we have a few call to actions for you. Please participate, give your input and feedback to guide this work. This work is for you. It's for the community. So it's really important for folks who are working at all levels as volunteers or as a staff in organizations to really provide their input into this work, to really guide this work. Linda, to your point, utilize the Healthy Aging Framework. So in the work that you're doing please reach out to us. We would be happy to support you in using the framework and provide input into the framework as well, so that we can continue to evolve that work. Please engage in the systems map. Someone asked earlier, I believe it was Ralph, how do you contribute to the map? Please reach out to us, to the regional community developers, and they're happy to have a conversation with you. Yeah. If folks are able to mute themselves, I believe there's a little bit of an echo coming across for some people. So yes, systems map, please reach out to us, and we're happy to support you, add your information to the systems map. Attend future events through the core newsletter. You can stay appraised as to future events. Again, we will share the information about the Alberta Association on Gerontology webinar on workforce planning that is happening. But please attend and participate. Become a core member if you're not already a member. Join a group on core as well, and just be a champion for this work. Please talk to people about it. Tell them what is going on and connect them to us. And just advocate for a coordinated sector that can really support older adults to thrive and age in our communities. And so we hope you will keep in touch, and we just thank you for attending. There will be a survey that will be sent out to you. And so we hope that you will take the time to complete that survey. It really helps us out to try to improve on our work going forward and on our events. Please stay tuned for that post-event email. It will include, again, the presentation and the slide decks from the presenters as well. And we hope that you will get in touch with your regional community developer and be able to have a conversation with them. And if you have any questions, again, just get in touch with us through that generic email. I believe Cindy has put the link to the survey in the chat as well, if you would like to just complete that right away. And so we would like to just leave you with a very final thought. And this is just a sentiment that was shared with us about the work. So obviously we are stronger together, and the issues that we're hoping to tackle are really something that requires a shared voice, not only within the community-based senior serving sector, but a shared voice alongside our systems partners as well. So we thank you all for being here today and for giving us of your time. And we hope to continue working with you on this journey. Thank you, Carrie.
Thanks, everybody.
Thank you, Sharon. Thanks, everyone.
Thank you, Miriam.
Thank you. I also just want to say thank you to my team. You guys are amazing.
Thank you, everybody.
That's great.
Thank you.
I put